Hello, Sandra. I'm Yoveda. I'm a student nurse. I'm following you tonight.
Hello. I have a SBAR report to give you
Okay.
on Mr. Ronald, and we have a 67-year-old male. He has no known allergies. He's a full code, medium fall risk. He has a history of type 1 diabetes. He's insulin dependent. He has a diabetic ulcer on the right heel, is stage 2. His pain level is at a 1. I've already oriented. He's alert and he knows where he's at. His gait is steady. His lungs are clear. He's on room air. He has a regular heartbeat, S1, S2, no breweries, no edema. His bowel sounds are ×4. He's on a sodium restriction diet. He has no Foley. He has an IV in his right arm, and he is on insulin. He's got Lantus and Humulin, and his blood sugar on the last time we checked it, it was high. It was 242, and his vitals are stable. He had been running a high BP. Now it's 128/70. His pulse is good, his respirations are good, and his O2 sats are good.
Why specifically this patient receiving this medication?
He's a type 1 diabetic. He's insulin dependent, so his body does not produce insulin.
What action does the medication have on the body?
Since he doesn't produce insulin, the insulin that we're going to give him has to do with his glucose metabolism. I'll work more on that. Skip to the next question.
When should you question administration this medication?
If the patient is showing signs of hypoglycemia.
Does this medication have a therapeutic serum level?
It's 60 to 100 is
Which-
what we would like him at.
Which vital signs must be monitored?
So we're going to monitor his blood pressure, his heart rate, his respirations, and we're going to assess him for any kind of signs of hypoglycemia, especially like tremors, shaking, things like that, sweating.
Which physiological parameters should you monitor when the medication is being administered?
Again, we want to monitor the patient and making sure that his blood sugar doesn't get too low, and if it does, then we would, give him the insulin, work on that later.
What intervention must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, we want to make sure that the client is, injecting himself in the correct sites, rotating those sites when he's at home, and then also we want to make sure while he's in the hospital that we check his levels before we administer.
What are the side effects and potential adverse reactions?
Hypoglycemia, shaking, nausea, dizziness, things like that.
How will you know this medication is effective?
If his glucose levels are therapeutic.
Thank you.
Okay, we're gonna go into the patient's room. Knock, knock. Hello. Your student, I'm your nurse. This is your student nurse, Yoveda. We're gonna be giving you some insulin, and I'm going to wash my hands before we get started. And we're gonna confirm your armband. And can you tell me your name and your date of birth?
Ronald Jarvis, 67 years old.
Okay. And I'm just going to confirm here in the chart that you are Ronald Jarvis, 67 years old, male.
If you have any problem, use the hand. That's what I'm here for too. Just let the video continue to roll.
Okay, so Mr. Ronald, we have an insulin that we're going to be giving you. Okay.
Well, did you already stop your video?
I am 67 years old.
Can we get a break?
We're going to pull up the MAR.
Video done. No breaks. That's why I said let the video
And we've already pulled our meds from the Pyxis. and we're going to confirm our medications with the MAR.
I can't use the same chart though.
Like, oh, I forgot this. Okay, I told me I forgot this.
Okay, so these are our medications that we pulled from the Pyxis, and we're going to confirm them with the MAR. So for the first medication, we're going to check the expiration date. So it's 2/18, 2/18, and then we have
You're submitting.
we have Lantus that we're going to be giving, and we have Humulin, and we're going to give that at 2,200 and 2,100. So this one's before bedtime, and this one is given 4 times a day, so we can give both of those. So it's 18 units, and the student can confirm
Yes.
18 units for the Lantus. And then this one, since his blood sugar was 242, according to the chart, 242 was checked. We are going to give 16 units,
If I go back
16 units,
in, do I,
because 242 is what we checked here, is glucose. So we're going to give 16 of that, and then we're going to give 18 units of the Lantus.
You can either continue on with that chart, or you can close that
Okay,
one and go into another.
so
If you want a fresh one, just close that.
let me scan your armband, Mr. Ronald.
No, just close out of that one.
Okay, so Mr. Ronald came up.
doesn't walk, doesn't like give you, it doesn't give you the same.
Okay, just scan your armband. Should it come up?
When something goes wrong,
We're gonna have to type it in. Okay. 9,1,9,2,6,4.
Michael,
Okay, now we're gonna scan the medication.
Michael. There you go, man.
He said it'll do it if it's flat.
That's what I did.
And I have to type it in.
We got, like I said, we can keep track of this.
E 0
That's what I
B
thought that these were just.
At first I thought it was
A
right.
There. Okay. So we've scanned the patient, we've scanned the medication. There it came up as the correct medication. Okay, our next one. So we're going to administer it
I do.
at 2,100.
what's the EHR? Like patient education.
And this is going to be 16 units.
I did. Yeah. You know how to handle the phone? Hey, Michael, this is yours. Do it on the photographer.
Who do you want being the patient? Can you be, you gonna be the nurse? Yeah?
Sure.
Self-practice.
Okay.
Yes.
All right. Okay, now we have Lantus.
Do it, doesn't matter if we do it. We can-
Learn off of my stroke.
It's already recorded.
All right, we're going to scan the patient's armband.
So you just continue the phase
Want
one?
to do it?
Yep, continue phase one.
Okay. This is what's taking so long.
And MR.
We have to log in our own.
How's it going to do
Log in
this?
our own.
Okay.
Yeah.
Oh, we do.
This thing don't work. Okay, we're just going to type in barcode here.
I'll just do it anyways.
That's no, think we have to use our own because it registers. It saves it.
No, it saves it.
Alright. Wait.
Alright, make sure there's no hands in front of them, okay?
Wait, stand right there.
The heck?
Okay.
Okay.
So,
You
hello, my
take
name
off
is
the
Manny.
clip, the
I'm
little
the
check
nurse
mark.
for the patient you're gonna see, and I wanna show you, I wanna talk to you about my patient, and what's going on with him, and then we're gonna do some administration of the medication, okay?
This is terrible.
Sure. The patient that we have today is Mr. Greg. First I looked. He's a full coat. He's 121 pounds, 5'11", and he's a 60-year-old with no known allergies. He's in a 1,800 calorie diet, diabetic diet, with 2 grams of sodium restriction. He has a history of hypertension and stage 2 diabetes ulcer.
All right.
Can you stop that? Yeah.
No, take the. Let's see what it does
Really?
there.
Recording.
Last time I let you do it like that.
The medication's not coming up like it did last time.
This was only 16
I
seconds.
don't know why it's goofing up
Do
like
that
that.
again.
But hey, I remember. I had to
Maybe type it lower, big.
It worked last
So-
time.
So you come into
Well, it has Lantus here, and it says we're gonna give 18
Okay, go ahead.
units.
And don't, okay, also remember. And this is the last question I'll ask. How we get there.
So that's it.
units.
Is it down good?
Just know when I flip the page, then we start.
And then he the patient. Okay.
Yeah, you start with the page.
Alright, go ahead.
So
Okay,
then
he
start-
said don't hit that until we, okay.
No, you can start with.
Yeah, you can
All right,
tell me that.
now we have our
Yeah,
syringes,
you don't wanna do the next.
and we've confirmed everything with the MAR. So right drug, right dose, right patient, right
So the
time,
patient that we have is,
and right
Mr. Greg.
documentation.
First name
Okay?
is,
Yes.
He's a full
All right,
coat.
so we have our
He has
alcohol,
no allergies.
and
he's
we're
a
going to
67
clean it.
year old male.
We're gonna put in air.
No smoker.
There's a clean
history of
syringe.
hypertension.
We're gonna put
He has
in
stage 2,
six-
diabetes,
16
ulcer in the right
units
heel, which
of
that's his,
air
primary diagnosis.
and to our
He
Humulin.
also has a history of diabetes mellitus
Okay,
type 1.
then we have 18
He was
units
admitted with a pain
for
of
the
pain
other
6.
one, for
Right
the,
now he has pain
um,
of 1,
for the
scale
Lantus.
after morphine. He's a risk for
I
pressure
don't like
sores
this because you
and,
can't see the MAR.
and
It's
we have
blocked.
our activity accelerated.
Okay, then we're going
He
to
has
draw
severe
up.
visual impairment. He uses glasses. Breath sounds are clear, effortless.
Our Lantus
Pulse rate is +2. It has
It's
loud
gonna
sounds are
be
normal and +4.
18 units.
Urine is clear and yellow, and so
That's
he's
20, that's
self-weighed.
19, that's 18.
Patient's vitals
Alright.
is
Yes,
also,
I see
this
18
afternoon,
units.
Yes.
is, respiration
And we're
16,
going to
O2
scoop.
96, and blood pressure 120/70.
Okay, we're going
he
to
has,
label our drug,
diabetic ulcer,
label the
stage
med.
2,
This is the
partial
Lantus.
thickness on the, right
Then we
here.
have our other syringe
He's
for our
receiving,
Humulin.
Normal saline.
Mm-hmm.
He has a cap, IV
Clean
catheter
it.
on the right medial vein.
We're gonna
and,
draw up 16 units.
And that's it right now. I have for my patient.
Why specifically is this client receiving this medication?
Well, the client is a diabetic client, and he's receiving insulin because he's way to
Okay.
help facilitate glucose intake into the cell. With,
This is our
facilitated diffusion,
Humulin.
which is
We're gonna
insulin carries the
scoop.
the glucose cell molecule into the cell.
When should you question administering this medication?
Well, you should question the
Scoop.
patients always.
Okay.
You should
And we're
assess the
gonna
patient
label
first
our med.
and, make sure the
Lantus
patient has that
Humulin.
drug, and question when there's.
And we're going to
glucose is
ask
too
the
low.
patient
Make
where
sure not give
where
it
would you like to be? Have your injection on your abdomen?
On my abdomen, please.
Okay, we're gonna wipe that off with alcohol.
Yes, circulation level is 70 to 100.
Let it dry. Okay, so Mr. Ronald, we have our Lantus that we're gonna
I always
give.
like to do vital signs, but at this point,
You're gonna fill a little
vital signs
stick.
are not as well
Okay.
known.
Okay.
Blood glucose
Okay.
levels,
All right.
So you can give it to me.
definitely look at the
Okay.
checks and A1C, we have one down.
Mm-hmm.
And as of
Very good.
3 months
Very
ago,
nice.
Sharps
Didn't feel
bucket,
anything.
right into the
Was
sharps
5.2.
bucket.
Which physical?
Okay, we have the Humulin we're going to inject you with. This is the long acting.
Engagement of the investor is good to show your patient for
In your abdomen again?
weakness.
Yes, get the other side,
Since,
please.
Yes.
the glucose level was too low, it can send the
Okay.
patient, hypovolemic shock.
That will be on the left abdomen,
What intervention
upper.
to define to ensure the medication is being administered safely?
Okay, here's the little stick.
Well,
Okay.
For
We're all
self-administration
good.
medication,
Sharps
it's
bucket.
good
Don't
to check
recap.
How to proper rotate the areas of
We gave the
administration
meds.
and to clean the area aseptically, and make sure to rotate the areas like I said, and in case of any erythema or anything, just switch to a different area. And
What
dispose
You
of
can
the sharps.
stop the recording.
interventions must be
Why is
followed
this
to
thing
ensure the medication is
messing
safe?
with